Abuse of substances such as marijuana, benzodiazepines, heroin, cocaine is prevalent in many communities around the country. Typically, individuals with such disorders request help only after they are forced to do so by family members, and they may also begin to have withdrawal symptoms when on admission for serious physical illness. This is because they have no access to the substance being abused. This may complicate treatment of the primary disease for which they are admitted. So main causes are social factors like peer pressure, for example, family members, friends, lack of coping skills, for example, with life difficulties, aids to coping in times of trouble. So addiction, tolerance, increased requirements of substance to maintain the same feeling, withdrawal effects, those unpleasant effects leads to a return to drug use. The main symptoms for cannabis withdrawal insomnia, shakiness, irritability, restlessness, anxiety, anger, with an onset within 24 hours of drug use and duration 1 to 2 weeks. For benzodiazepine withdrawal, anxiety, headache, insomnia, muscle aching and twitching, perceptual changes, feelings of unreality, depersonalization, seizures with an onset 1 to 10 days, depending on half-life of drug, and duration 3 to 6 weeks, and maybe longer. Also, opioid withdrawal. The symptoms are anxiety, craving, muscle tension, muscle and bone ache, muscle cramps, and sustained contractions, sleep disturbance, sweating, hot and cold flashes, piloerection, yawning, lacrimation, rhinorrhea, abdominal cramps, nausea, vomiting, diarrhea, palpitations, elevated pulse and blood pressure, dilated pupils, with an onset 6 to 24 hours, maybe later with longer acting opioids, and duration peaks 2 to 4 days and ceases 5 to 10 days, and more prolonged for longer acting opioids. Psychostimulant withdrawal have crash, as fatigue, flat affect, increased sleep and reduced cravings. So those are the symptoms for psychostimulant withdrawal. And also it could be fluctuating mood and energy levels, that's the withdrawal. Cravings, disturbed sleep, poor concentration, as well extension, that's persistence of withdrawal features gradually subsiding. Okay, so the main psychostimulant withdrawal symptoms are crash, withdrawal, and also extension. So the onset is 6 to 12 hours, that's for cocaine, and 12 to 24 hours for amphetamines, and the duration is several weeks for withdrawal phase and then months for extension. So the signs that are usually elicited for cannabis withdrawal, benzodiazepine withdrawal, opioid withdrawal, and psychostimulant withdrawal are the same as the symptoms I mentioned. Investigations: toxicology screen for suspected substances. Screening of patients suspected of substance use. A physical appearance: the sweating, tremor, agitation, problem with coordination, gait. You rate these appearances and reassess them at regular intervals to monitor the progress of symptoms. If symptoms are increasing in severity, notify a senior staff member or, if available, a doctor. And suicide risk assessment to determine the level of risk at a given time and to provide appropriate clinical care and management. Possible suicidal behavior includes thinking about suicide, harming oneself, or attempting suicide. Screening questions of suicide risk. Have things been so bad lately that you've thought you'd rather not be here? Have you had any thoughts of harming yourself? So these are some of the questions I ask. And are you thinking of suicide? Do you have any plans of committing suicide? Have you ever tried to harm yourself? Have you made any current plans? And do you have access to anything with which to hurt yourself? So these are some of the questions. Also, mental state examination to determine the need for other psychological therapies and concomitant psychiatric conditions. So for the concomitant psychiatric conditions, the ones which place a patient or others at risk. Also the patient's capacity for informed consent and active participation in treatment planning. Also, for assessment of psychosocial factors affecting withdrawal, you ask the patient about the reasons for presenting for withdrawal management at this time, and also the past experiences, current knowledge and fears of withdrawal, perceived ability to cope with withdrawal and its treatment, family support and social networks available for withdrawal treatment, potential barriers to successful withdrawal, care of children, as assess possible neglect or physical or sexual abuse of children, or exposure to such harm from others, and intervene to protect as soon as possible or refer to appropriate agency. Also, drug use of cohabitants and current legal issues, financial problems, and work commitments. So the main treatment objectives are to provide supportive care, information, stress reduction, reassurance, to teach coping skills, relaxation techniques, dietary guidelines, methods to reduce craving for the substance, sleep disturbance management, to manage difficult behavior, anxiety, agitation, panic, and aggression. Also, to manage confusion, disorientation, and hallucinations, to plan and organize discharge, follow up, and aftercare to prevent relapse. Non-pharmacological treatments, cognitive behavior therapy, stress management to reduce craving. For pharmacological treatments, the management of withdrawal symptoms in cannabis requires no medical intervention. Management of withdrawal symptoms for stimulants requires observation but does not require a specific intervention. For the management of withdrawal symptoms, as in benzodiazepines, substitute with equivalent dose of benzodiazepine for a few days, and then taper off dose over 2 to 3 weeks. The management of withdrawal symptoms, opiates, oral rehydration fluids, or IV fluids may be required. Also, long-acting benzodiazepines, for example, diazepam, to control insomnia and muscle cramps. So, antiemetics, for example, promethazine for nausea and vomiting, and methadone, buprenorphine, and clonidine may be used as where available and with caution to reduce the severity of symptoms. and NSAIDs, that's non-steroidal anti-inflammatory drugs, for example, ibuprofen, diclofenac, for pain relief. So referral criteria: you refer for specialists, as psychiatrist or clinical psychologist care and management if withdrawal symptoms are particularly distressful, and do not respond to treatment, or when there are repeated relapses. Refer for cognitive behavior therapy to a clinical psychologist.